Good morning, everyone. Welcome to Pediatric Grand Rounds. Thank you for joining us in person. Please come by if you're anywhere near the Tanglewood complex, and thank you for joining us online. Today's presenters are Dr. Violet Borowicz and Tammy Campbell from Care Connection. Dr. Borowicz grew up in Maryland and went to medical school in Philadelphia. She completed her pediatric residency at Alfred DuPont in Wilmington, Delaware, and a Mount Fellowship at Children's National in Washington, D.C. She joined Carilion Children's in 2014 as a pediatric hematologist, oncologist, and as a pediatric palliative medicine physician. She became a medical director for Care Connection in 2017 and an associate program director for the pediatric residency in 2019. She lives in Roanoke with her two little cuties. Tammy Campbell has worked for Carilion for the last 25 years. She has been with the pediatric team and the Care Connection for Children for the past 11 years. She is also the Revenue Operations Manager for the Pediatric Department. She has one daughter that lives in Wilmington, North Carolina. She lives in Madison Heights with her husband and two doggies. Please join me in welcoming Dr. Borowicz and Tammy Campbell.
Hi, everybody. I'm going to try to get through this without coughing too much. So today we wanted to introduce Care Connection again. We have a lot of new faculty that have joined our team, and a lot of people don't realize what Care Connection is. So that's why we're here today. We have no financial disclosures. So Roanoke Area Care Connection for Children is sponsored by the Virginia Department of Health. It is a statewide network of regional programs that provides healthcare coordination, community support, and resources to children who have special healthcare needs. All children and youth residing in Virginia who have special healthcare needs are eligible to receive these family-centered, community-based, culturally sensitive, comprehensive, multidisciplinary specialty services. And we strive to accomplish the Federal Maternal and Child Health Bureau's performance measures for children and youth with special health care needs. This is our team. So we have Tammy Campbell, who is our program director. We've got Patricia, who's our education consultant, and then numerous care coordinators who help with our patients. So Jody, Julie, Ann, Courtney, and Faith. And then we have Elizabeth Jones, who joined us very recently, January, who is our community health worker. And then Jen, who is our healthcare administrative associate. So to be eligible for Care Connection, you have to be a resident of the Commonwealth of Virginia. You don't have to be a citizen of the U.S. You just have to have be a resident of the state with an address. So a P.O. box does not count as an address. You have to be under the age of 21, so anyone from birth to 21 qualifies. And you're diagnosed with a physical disorder that has lasted or is expected to last at least a year. There also needs to be a need for healthcare and ancillary services over and above what's usually provided for the child's age, a need for special ongoing treatments, interventions, or accommodations at home or at school. Limitation in functions, activities, or social roles in the comparison with healthy age peers in the general areas of physical, cognitive, and social growth and development. And a dependency on one of the following to compensate for minimizing limitations of functions of activities and social roles, so medication, special diet, medical technologies, assistive devices, or personal assistance. So there are 6 different locations that the Virginia Department of Health has designated these areas to service different parts of Virginia. And so there are Care Connection locations in each of these areas that you see highlighted here. We are the light blue, the Roanoke area. And there is one in even further southwest Virginia that serves, and that's located in Bristol. So there are children who do not actually, if they have a primary diagnosis of any of these following things, they do not qualify. to be on Care Connection or for the pool of funds that's given by the state of Virginia. So having allergy or asthma alone, having cancer, having hemophilia or bleeding disorder, HIV or AIDS, if those are separate and their only diagnosis, they actually do not qualify to be part of Care Connection. But if they have epilepsy and HIV or epilepsy or something else, then they can qualify for Care Connection. And if these referrals do come in, there can be made referrals, appropriate community resources for the children and families. So my role is really to act as a liaison for clinical and medical questions, and then to help with the transition to adult care. So what we like to have from all of our pediatric subspecialists is a list of adult subspecialists who you guys transition patients to, because it does help in trying to coordinate our patients' care when they transition to adulthood. And then we'll hand this over to Tammy.
Thank you. Good morning. I wanted to talk a little bit about our referral process, and it's a little different than the referrals that we have in EPIC, where you just place the referral to a department that you want the patient to go to. The patient has to consent. So if they do not want the services, we can't make them sign up for Care Connection. So we will send a message back to you all to let you know that they decline the services. For you to be able to get in touch with us, unfortunately, right now, we're not on EPIC, but we do have a paper referral, and Jennifer has a packet if you'd like one of those packets to take with you today. You can in-basket Jennifer Roop or myself. Just make sure that in that in-basket you include the patient's name, the parent or guardian of that child, their address, the county they live in, and a phone number for us to get in touch with them, and that diagnosis that you're treating them for. Our office number is 769-0972. You can call Jennifer. She has a voicemail if she's not available that you can ask for a referral at that point as well. Now I'm going to turn it over to our care coordinators. And if you'll introduce yourself.
Okay. Hey everybody, my name is Courtney Ferris. I am one of the several care coordinators with Care Connection for Children. I started with Care Connection back in December, transitioning from bedside ER ICU over to pediatric case management, which is totally different ballgame. So I've been learning as I go, but Care Connection is a great program and I'm excited to tell you a little bit more about it. So basically, Care Connection, we are here to help connect people with resources, providers, specialists, help them with health insurance options, help them navigate Medicaid if that's something that they need help with. Also exploring payment options outside of health insurance to help cover things that insurance may not cover. Looking for community resources in the area. We do serve, on that map you saw, we serve 33 counties, and we do, even though there is the Southwest Care Connection, a lot of those kids come here for specialty care, and sometimes we do get referrals in the Roanoke area Care Connection for those kids who are solely seen here at Carilion as well for their specialty care. We have Patty, who is our education consultant. She helps with all of the school issues and things that you guys send us referral for, and she will touch base on that in a little bit. And we also do try to connect our families who may have similar diagnoses. If we can, we try to connect them with each other and also support groups, local support groups if we can, to help them get some education and have some extra support with other families who have similar situations. So a little bit of back history of Care Connection. We are a grant-funded organization, and we are funded through the Title V Maternal and Child Health Block Grant. And this all came about with the polio epidemic in the 1940s and 50s. It affected so many people that there was a lack of limited access to care. And so that's kind of where our model for Care Connection came in to help connect these people with polio who had complex medical issues following the polio diagnosis and were having trouble finding access or funds, resources to care for those kids who had the effects of polio. We have had many different titles over the years. Our first began as the Society for the Crippled of Southwest Virginia, then transitioned to the Bureau of Crippled Children, Children's Specialty Services, and now we are Roanoke Area Care Connection for Children. From 1950 to 1965, there was still some issues with limited access to health care. And President Lyndon Johnson expanded Medicaid to help cover children with special needs back in 1965. So that expansion gave those children the comprehensive health plan so that they can get mental health services, testing, screening, immunizations, medications, et cetera, that they weren't able to get before. And Virginia recognized the need for providing comprehensive services to children with special needs, so Care Connection for Children was created as a clinic model. So like I said, we were several different names, the Society for the Crippled of Southwest Virginia, or United Fund Agency, and orthopedics was the original clinic started by Dr. Philip Trout, Louis Ripley, and Charles Bray from the Roanoke Orthopedic Clinic. In 1975, we went under complete state supervision through the Virginia Department of Health. The state reimbursed all the salaries, but there were no benefits for the employees at that time. The Care Connection Office, or Bureau for the Crippled Children, was comprised of Roanoke RMH employees and state reimbursed RMH for all of the salaries. They provided neurosurgery, urology, a audiology clinic, eye surgery, and eventually cardiology and neurology. In 1974, we went under complete state supervision. And then in the mid-90s, the Medicaid expansion allowed for pediatric specialists to open private practice to Medicaid recipient. At this point, the access to care was improving, but patients still were having issues. They found the issues were not so much the Medicaid and the insurance piece, but more barriers to scheduling appointments, getting referrals, transportation, a lack of understanding of the treatment plans, so a need for education for the families. There was more about the social aspect than the insurance and medical aspect. So in 2003, the clinic model changed to the care coordination model, which is what we are today. And the name changed from Roanoke to Roanoke Care Connection for Children, and serving the same group of children with special healthcare needs and providing care coordination and direct clinical services. And in 2010, we then moved to Roanoke City Health Department, and we are currently housed here at Carilion. I'm going to turn it over to Ann.
My name is Ann Winke, and I have been with Care Connection for 2.5 years. I've been with Carilion for 17 years and held various roles, coming from administration and then into home health, where I was the pediatric home health provider. So I worked with many of you pediatricians and pediatric providers from the home health side. I may have never met you face to face. It's good to be here today because we are behind the scenes. And I want to explain what we do on a day-to-day basis with Care Connection. We bridge together medical professionals, educators, the family, with a child with complex medical needs to determine how they can reach their maximum potential. That's our goal. We meet the families where they are. We have families from the most savvy parent that seems they know how to navigate things, to families and parents who have needs themselves that find it difficult to do things like appointment scheduling. So some of the things we do on a daily basis are assisting families with appointment scheduling, to appointment reminders, to transportation scheduling and reminders, to access to dental, vision care, access to their durable medical equipment and working with those companies, access to prescription drugs if they're encountering denials or problems with those, assistance with school for various issues that come up as a child transitions from birth to age 21. Also through the many waiver support programs that we have in the state of Virginia, from SSI application assistance to WIC assistance. And we also work with all the providers to make sure that happens. So we frequently call and collaborate with care coordinators from various entities. We work with our local social services. We also work with our health departments in the localities that we serve for our patients. And what we do when a child is enrolled in Care Connection services is we determine their insurance status. So if they don't have insurance, we work with everything from the Medicaid application process all the way through to the status of being approved or denied. We work with assisting with Carilion medical assistance, financial aspects, and we also work with those that do have commercial or private insurance from an employer-supported insurance plan. So what does that look like for some? To give an example, I had a child that had a commercial insurance that the family had an employer, provided plan. The child was not a type 1 or type 2 diabetic, but needed continuous glucose monitoring. And the family got a bill from the provider of the CGMs for $6,800 that needed to be paid within 30 days. So we worked with the family and went to the plan's administrator, and the plan's administrator was actually able to change that employer offered plan to change language, to not only cover type 1, type 2 diabetics for CGMs, but one that also covered the entity of the diagnosis this child had. So it's a long and tedious process, but we invest that time to work with the families to get those things accomplished. For those that have Medicaid denials, we work with community resources and charitable organizations to get certain equipment approved as well. And then those that are underinsured or no insurance at all, we have a very limited pool of funds from the state. It is very strict eligibility requirements. They have to be at or below 300% the poverty level in order to qualify for that very specific pool of funds. But it covers things like hospitalizations, prescription drug assistance, durable medical equipment, or therapies. One thing that we encountered this summer is one of our big providers for pediatric durable medical equipment closed. It was very tough to assist our families to work through that process, but as a result, we were able to establish relationships with representatives and decision makers from DMAS. So what we do is if we encounter a child or family that they've been denied certain medical equipment, certain therapies, and certain prescriptions, we now have contacts that we can help the provider and help that family work through that process to get it written in a way to get that provided. So, we want you guys to think of us when it comes to that and the referrals. So we've had everything from parents that are physicians, lawyers, to those that can't read, that don't speak English. So we meet everyone where they are, and it's an absolute joy for us to do what we do on a daily basis, helping these kids reach 21, and that's our goal, is to help them through that transition of care process. So it's nice to talk to you guys today. All right, Courtney.
So I'm just going to touch really quickly. Community resources is another big thing that we encounter on a daily basis. We come across new resources in the community daily on a case-by-case scenario. To give you an example, I had a child who is a nonverbal autistic child. He had several other diagnoses that qualified him for Care Connection. He is on a employer commercial insurance plan, and they have already used, the family, both parents work full-time. They had already used their Medicaid spending allowance to make home improvements for him. And as he has gotten older, he has become more and more of an elopement risk. But family has done everything they can financially within their financial means to help contain him and keep him safe. He does have Project Lifesaver, but he still has been able to get out of their home. And of course, they had mom sleeping in the floor in front of his door, dad sleeping on the couch. Nobody's getting a good restful night's sleep. So I wrote a letter to an organization in the Virginia area that has bought them a home security system. So it has indoor cameras, motion sensors, outdoor cameras, in an effort to help better monitor him. So those are some of the things that we do. We reach out. There's obviously some of the big ones that people know about, the mission. There's lots of local churches that have food pantries. We do have some families who have issues with the rising cost of foods. Their food stamps are not covering them for the whole month and are having issues with access to food. So we have, food pantries and lots of other, there's Huddle Up Moms. There are so many numerous, I could go on and on about different community resources. And like I said, we find new community resources every day on a case-by-case basis. And that's something that we help connect families with as well. And I'm going to turn it over to Patty to talk about school and her role.
Thank you, Courtney. Good morning. I'm Patricia Feldbaum, and I am the Educational Consultant for Care Connection for Children. And I don't know how to move this. Space bar. There you go. I have been with Care Connection for more than 10 years, which makes me one of the old timers, I think. I've been in the field of special education for 35 plus years. So I have seen many, many changes throughout, like historical changes in the field of special education. Some of the things that I do, I work with the families. I'm the secondary support. So if the child has a qualifying medical diagnosis and they need support in schools, or the family doesn't understand what that might look like in the school setting, then I work with the team to talk to the families, talk to the schools, facilitate that, so that the child receives the special supports and accommodations and services in the school setting that is appropriate, that is developmentally appropriate. I assist with, since we do 0 through 21, I assist throughout the years with that transition piece. When a child starts in early intervention, and then when the child turns 3, and then goes to the school system for preschool services, all the way through after graduation, what does the child do, or what are the needs that the child has after they are no longer in high school. I work with families on determining what is a good program for that child based on his needs. And I work with the school district and the families to talk about those things. The other things that I do, I can discuss extended school year for children and summer camps. We have Elizabeth, who does a great job with summer camps and other programs. And that's what I do. Hold on. Elizabeth?
All right, so my name is Elizabeth Jones. I'm the community health worker with Care Connection for Children. I've been here since January, so I've gotten into sort of a groove, and I've really enjoyed working with everybody. So my role is, I'm sort of the liaison between the medical world and the community. And so I sort of help fill that gap between, the sometimes overwhelming world of medicine, especially for these families who have multiple doctor's appointments, multiple specialists they see and all of that. And so I meld that with everyday life and try to make it not as overwhelming for them. I believe as a mother of a child with special needs myself, my son has a rare genetic syndrome called Pediatric syndrome. And you can ask me about that because most people don't know about it. But it's very similar to autism. Anyway, I feel that because I have that experience myself, I'm able to be sort of a peer counselor as well, because I understand how overwhelming it can be, working with all of these different specialists. So I do that, but I'm also sort of an advocate. As you can see, I have a lot of different roles, but what my major role is trying to find resources in the community. So I sort of take what the care coordinators do. They give me referrals for specific things that this patient might need. So anyway, I guess that's part of what I do. When I first started the job, my role was trying to find dentists for these patients. Finding a dentist that takes Medicaid is very hard. So, that was a challenge, but we met those challenges pretty well. But since then, my scope of practice has expanded to everything from making potty training goals to setting appointment reminder goals, scheduling doctor's appointments, finding adoption lawyers in rural areas, all the way to helping patients get new wheelchairs, helping them make appointments for getting new supportive braces. But the biggest one I've been dealing with is trying to navigate the Medicaid world, because on its best day, Medicaid can be extremely confusing, and these families already have so much going on, and so I try to kind of make that process a little bit easier. And so, in order to make that process less overwhelming, we use something, in my role, I use something called SMART goals. And as you can see, the S is specific, measurable, attainable, relevant, and timely. That's to make it less overwhelming. So we take those goals and we make them into smaller goals. So for example, I work with a patient who has sickle cell, and her father makes too much money to qualify for regular Medicaid. But there's something called long-term care Medicaid, where the patient cannot be denied coverage because of income, which is great. But a lot of people don't realize that. So in order to qualify for this long-term care Medicaid, they have to go through a screening process with the Department of Health. And so, already, your eyes might be glazing over, because this is just a very long, drawn-out process. You have to apply, you have to call for screening, you have to do the screening. I mean, it's just a lot. And these families, again, are overwhelmed. And so what I do, I take those goals, that ultimate goal, right, to try to get that long-term care Medicaid, and I make it into okay, this week, I told the father, this week we're going to print out the application, we're going to fill out the application, I'll fill it out with you over the phone, so it's not too much. I'll tell you exactly how you need to fill it out, because there's specific ways you need to fill it out, and that will be that. And we'll take it to the Department of Health, and then we'll call the next week. The next goal will be to call for a screening. So it's smaller goals to make it less, huge, because we have to, in my own life, I have to make things smaller. So anyway, this was a really great story. The patient ended up passing the screening. I say passing, meaning her condition qualified her immediately. They were immediately approved. Then they went through everything. They were able to get long-term care Medicaid, which was huge, because this family, again, the dad made enough money to support them, but did he make enough money to pay for all the therapies that the daughter needs, all the things that would make her life better and make her reach her potential, right? Which is what our goal is. And so that was really wonderful to hear that. So I think that's sort of my goal, is to try to make it less overwhelming for them, try to meet them again where they're at. And yeah, I mean, that's basically what I do. If you have any questions, feel free to reach out to me.
One thing I will say is referrals can also be made from an inpatient standpoint. The pre-COVID, the Care Connection used to be able to go to the IDT meetings to try to gather these patients, but after COVID happened, they haven't been able to join the IDT meetings. If you have a patient that you know of that isn't getting Care Connection services, asking them while they're inpatient is helpful, because we can get those referrals from an inpatient standpoint. I had a kid who I saw as a palliative follow-up from NICU with spina bifida, and the parents did not get connected with Care Connection, and mom just said that they didn't even get their Medicaid set up before they got discharged. And mom was like, well, they told me it was in, and we kept calling and it's not in. I called them, and she actually ended up getting admitted to the PICU, and like within 24 hours of being admitted to the PICU, like Medicaid was fixed, everything was done. And so these patients really need that help, because it is hard. I don't understand any of it. And we don't learn this insurance world. That's what this team is here for. And so from an inpatient standpoint, it is helpful too if you get those patients, if you're screening them when you're seeing them, and you can ask them, like, if you think they might be qualified, if they've heard Care Connection, if they're involved, because that can be another resource to get them in before they get discharged. And then just a quick thing about our sickle cell population do qualify for Care Connection. We are not referring them just right away at birth, because usually when they're babies, they don't really need a whole lot, and so parents don't really get engaged in Care Connection right away, but it's more important to get them when they're older and they're having more complications from it. We try to get them involved just to get those resources. I know Patty's been a big help with some of our kids with school issues that we've had along the way too, for some of our sickle cell kids. And if you guys have any questions, yeah.
You seem to have a really wide catchment. How many patients or families are you carrying at any one period of time?
Our full-time care coordinators keep roughly 75 caseload. Right now we have 382 with all of our care coordinators.
That's multiple counties.
So for anybody online, I don't know if you heard, the question was how many do we have? Each full-time care coordinator has about 75, and there's a total of 382 patients enrolled on Care Connection right now.
Corollary question to that is, what's your bandwidth?
Well,
How many do you want?
the part about it is, like, all of these don't last all the time.
Right.
So we're closing cases like on a weekly basis. So we help them with the needs, then we close the case, then they can come back if they need services again. We've never had to put anybody on a wait list, let me just put it that way.
And I guess yet further, and I asked somebody had another question. This is a finger pointing at us as providers. Where's the biggest opportunity that you see might be missed? Is there a particular area that we're maybe not identifying how we could help these kids as much?
I feel, from my standpoint, just from when I see these kids in palliative, I think they're getting missed in inpatient. NICU specifically could be a big place, because I think a lot of those kids get diagnosed in the NICU, and then I think NICU could be a big referral place.
And offline, I want to know why you can't go back to IDT if you want to. But let's talk offline on that.
I was curious about the list of exclusions, which was initial. It seemed
The list of exclusions.
seemed a lot. I think it was the third or fourth slide.
This is what was dictated by the grant funding. I think that is what the grant dictated. I know specifically for just specifically for PT-MONC, cancer and tumors don't qualify, hemophilia and other bleeding disorders don't qualify because there are other services for those. So like the state designates some centers, like UVA is a designated hemophilia treatment center. We're not, but because UVA is, and they have specific funding for hemophilia and bleeding, then they don't qualify for Care Connection. And similar for cancer and tumors, because there's so many other resources for pediatric cancer, they don't qualify. I don't know about the other.
And it also goes back to what Dr. Pierce asked about how many we can take. A lot of your cancer, asthma, and hemophilia, you have a lot of kids on that. We don't have enough staff to handle the patient volumes for that. So they listed a list of exclusions of what they would cover and what they wouldn't cover.
And I think the pool of funds too is also very limited.
We're just at the bottom, that's
The developmental
That's a
disabilities, yeah.
Is that if the developmental disability is only a single
Yeah,
diagnosis?
it's
So
only
they have,
a single
they
diagnosis.
have cerebral palsy with it?
Correct.
They can qualify then?
or
Okay.
genetic syndrome.
Because that's
or
something,
something.
that's the reason I thought you took.
Yeah, and if you look at that list, usually the kids who are on that list have something else. Like, very rarely do they just have that one diagnosis. So the good part that we work hand in hand, we did add the social workers to our pediatric department. So if we find that there's kids who don't meet our catchment area, we work with the social workers and some of the care coordinators in the clinics, and they handle those patients. So we're still not just not doing anything for them. So we still have other avenues to help them as well.
Hi, I think this was a very, very good opportunity for me to hear this because I'm not familiar with Care Connection. I just saw a family last week and you mentioned how tough it is to navigate kind of insurances and what have you. So the situation the mother of my patient is experiencing, I mean, they have two different households. The father is in charge of giving the financial support, but the commercial insurance stopped paying for the child's feeding supplies and formula, but because it is the father that needs to initiate, because they have Medicaid, but Medicaid won't cover because they were saying something to me about the EOB that hasn't been specified. So she's been trying to pay for everything herself, and she has limited funds, and she's just going into the red. And so it's relatively recent that subspecialists can reach out to our social workers. So that's what I did. But should I have also kind of asked to kind of coordinate with Care Connection? Would that be something that could help this mother and this family?
You can, but the social workers, we usually talk among ourselves because we're in the same office.
Okay.
So we share the cases. So if it's something they feel like that Care Connection can take, they'll discuss it with us as well.
Because it's just to kind of move it over because, I didn't even realize that this was a thing. So.
Yeah, and the social worker will refer them to us.
Okay.
Once you send it to them.
Thank you.
I think that is a big thing, especially in the outpatient setting, is the social workers can do the referral too. It doesn't have to come from the physician, so that has helped.
And the care coordinator said we did get that referral, so we do have that one.
Thank you so much.
There's a couple online. Dr. Drake asked, what are examples of conditions that do qualify that might be surprising? Sickle cell makes sense, but anything requiring maybe less intensive therapies?
I mean, we get things as simple as congenital hypothyroidism from a newborn screening services. We get referrals from newborn screening services if it flags on there. So something as simple as congenital hypothyroidism. Now, we may talk to them. They may say, hey, we don't need, Care Connection. We understand the diagnosis. We don't need help with access to anything. And there are times that they do still need help. So it's a wide variety from patients on ventilators with trachs to something, as quote unquote simple as hypothyroidism being the only diagnosis.
Or type 1 diabetes. That's
Right.
Type 1 diabetes.
Yes.
What about EOS?
And then one thing to point out too is the newborn screening results if they're abnormal, they do get sent to Care Connection.
Yeah, all of those are automatically sent to us if they're abnormal.
Care Connection does get those referrals automatically from the state.
So really, any medical condition that's going to last 12 months or more that doesn't fall into the exclusion, 33% of children in the Commonwealth of Virginia have a complex medical problem. And I think what I've seen over my 13 years in caring for pediatric patients and then coming into this role is that parents and families are showing up for appointments. They seem super savvy and knowledgeable about the diagnosis in the healthcare system, but they qualify more than likely. And things change within the Commonwealth every day. The child changes every day. Things are dynamic. We learn something new every single day in our role. it takes hours to navigate the system, and parents don't have access to the resources we have access to. So just because a family seems super savvy does not mean they shouldn't be referred to us. So I think there's a lot of missed opportunities with children with complex medical conditions. I have children come into service that I found in home health. They're 16, they have a wound. They never knew about waiver support, Medicaid services, or anything they've been entitled to, and they've missed that opportunity up until nearly they're 18. We've had referrals when they're 18, since we see until 21, and no one's talked with them about any long-term waiver or any guardianship. We handle all of those issues, and when they're 18 in one day is not the time to have discussions with the family about that.
Is it a federally funded program? What's it? State.
I think it's state level. There's like, oh, it is federal. Oh. There you go.
There's one more online. Could patients be receiving hospice and care coordination services at the same time?
Absolutely.
Yes.
Yes. And we're working with that now, starting to identify changing language, verbiage, making palliative services, hospice services available to those patients. So
The difference for kids who get enrolled on hospice is that pediatric patients on hospice can actually receive concurrent care. So that's why they can. It's different in pediatrics than it is in adults. A lot of times in adults, you can't receive concurrent care. But patients who are enrolled on hospice can still pursue treatment options. Any other questions?
Any luck in getting dental support?
Yeah, we've had
I
some.
was gonna say, Elizabeth has been a rock star at finding
Well,
dentists.
it's all who you talk to, right? You get the right person on the phone, and yeah, it's been good.
You got an appointment for somebody in Richmond, right?
Yes.
So-
And we
Finally.
also made dental a scorecard initiative for Care Connection to make sure when they come into the program, they have a dentist that they're following up, because that seems to be an afterthought to the medical care. So we've really been striving to work on that piece as well.